In this video, we'll review a vascular ligation technique using a horizontal mattress suture. In this technique, you'll first throw deep superficial on one side of the bleeding blood vessel. You'll then rearm your suture needle, and this time you're going to throw from superficial to deep on the other side of where you see the bleeding from the blood vessel. The assumption in using this technique is that you can't clearly see that cut end of the blood vessel, or if you can, that cut end of the blood vessel is very short. Otherwise, you would simply clamp off the end of the blood vessel and ligate it. After you tie off your horizontal mattress suture, you should make sure that you've obtained hemostasis with your tie. You'll then throw some additional throws and cut the free end of the suture. For clarity of demonstration purposes, I'm using nylon suture in this demonstration, but in a real situation, since the suture is going to be buried, you would use an absorbable suture such as Vicryl. Let's take a second look up closer. Again, we locate the bleeding from the cut end of the blood vessel. What I like to imagine is that there is a square box surrounding that bleeding source. Each of the four corners of that square box are the points of entry and exit for my suture. And what I'll be doing is trying to roughly approximate the location of the bleeding in order to encircle and ensnare that blood vessel to stop the bleeding. In this technique, you'll note I'm not directly ligating the blood vessel, but rather I'm using extrinsic compression of the surrounding tissues in order to obtain hemostasis and stop bleeding from that blood vessel. Again, I'll tie off several ties in order to secure the knot using the instrument tie technique. And after cutting the suture end, it's important to watch to make sure that you've achieved hemostasis. For a review of this technique and other techniques for vascular ligation, visit lacerationrepair.com.